Hi, welcome everybody. I'm Shruti Mehrotra, Head of Marketing at Aerogram. We're going to kickstart the event now. And I would like to say that we're meeting in interesting times. Healthcare continues to face mounting challenges in 2025 with staffing shortages, rising patient demands, and administrative bottlenecks in the midst of it all. AI is emerging as the game changer we've all been waiting for, with predictions that AI will soon handle up to 60% of front office tasks in healthcare practices. The future is not just coming, it's here. From automating repetitive front office tasks to tackling complex decision making, the possibilities are endless. And today, we're diving into how this technology is transforming operations in real world settings. I'm thrilled to introduce our speakers. We have Oscar Ortega, Managing Partner, Cream Digital, who has been instrumental in setting up AI infrastructures that streamline business operations at a range of businesses, including medical offices. And we also have Kashyap Purani with us, who is the brains behind the revenue operation automations at Aragram. Together, they unpack how AI can change the face of front office operations, freeing up time for staff and enhancing patient satisfaction. Let's dive in. The floor is yours, Oscar.
Thank you so much, Rudy. I appreciate your time. And Cash, I appreciate you taking the time to book this with us so we can talk about everything AI. We can get wax poetic on all the different changes that are in the, that are happening. So let me just get right to it.
Yeah,
I'm
very excited.
going to share my screen right now. And so what you see here is an AI infrastructure that we've been able to build out for different medical practices, and to Shruti's point, getting into kind of some of the pain points in the medical space right now. The way that we look at medical practices and how we can solve their problems in the front desk is we look at ways or the different tasks that each respective position handles, right? And so let's say, take for example, the AI patient coordinator. So we look for the key tasks that they handle. For example, they handle call routing, call handling, collecting patient information, verifying insurance, collecting payment, managing paperwork, data entry, etc. Right? So then we look for ways to leverage AI to either optimize, automate, or eliminate that role that they have to do entirely, so they can focus on higher ROI tasks, right? And so what AI can take off their plate immediately would be patient information collection, and that can be done a number of different ways. Insurance verification, and now we can do that with Aerogram. Automated scheduling, document management, data entry, and billing, right? And so those are some of the key tasks that today we can immediately handle or hand over to AI in a way that is effective, optimized, and again, brings a nice ROI to the medical practice. So first things first, the first thing we're going to talk about on the front desk infrastructure is the what I call the intelligent call routing, but the automated call routing. And so this is especially crucial for medical practices that have a high call volume. And so oftentimes they have a ton of missed calls, they can't get to them all, and not every single phone call is of the utmost importance, right? And I mean that respectfully. Some of these phone calls might just be information on your practice. Hey, what are your hours? Do you accept this insurance provider? What are your services? What are your provider's name, right? And so what's your address? Those questions can be handled with AI very easily, right? I mean, AI can handle these things 24/7, 365 without breaking much of a sweat. And so it allows your staff to handle the questions or the calls that are kind of more related to, again, higher ROI tasks, right? And so first things first, we install an automated call system to route these calls intelligently to and from departments. And then we also have the intake portion, right, where we're
Yeah,
able to intake.
it would be great if you can zoom in a little bit so we can read more better. Thanks.
This one here.
Yeah, whatever you're focusing on, yeah, you can zoom in so
Yeah,
we
there
can
you
read.
go.
Yeah, thanks.
So again, it can route calls to and from different departments, specific employees, and it can route calls in a way that is very natural, right? So suppose that the practice is located on Southwest 8th Street, right? It'll know what practice is located on Southwest 8th Street and then transfer the call accordingly. It doesn't have to be like an IVR where it's very kind of static and stiff. This is very dynamic, right? And so we can also ask qualifying questions, right? Suppose it's a patient that wants to book an appointment. It can ask if you're a new or an existing patient, and then based on that parameter that we set, it goes in a specific direction, right? Because you may want the patient to book an appointment if they're new with your AI, or you might want to book it directly with your own patient coordinator. So that's the first step, right? Is really understanding the first layer of defense, which is the intelligent call routing, and then the next layer, right, would be your intake. And we can intake patients a number of different ways. It can be done via SMS, via WhatsApp, via email, on your website, or via AI voice, right? The goal here is to make it as easy as possible for your patient to be able to book an appointment with your practice in a way that is accurate and safe, okay? So we can integrate with 99.99% of all EHR or PMS systems. If they don't have an API, we have different workarounds that are, again, compliant and safe. But the goal here is to sync your calendar to make sure that we're not overbooking or double booking, asking the qualifying questions to make sure that the patient is, one, qualified, two, that we're kind of tagging them with the right visit type, and then adding that information into the EHR and or notifying your staff of a new appointment, right? So that entire process, again, is streamlined, can be done with AI. It can be done in English and Spanish or any other language. If you're in a specific part of the US where there might be other ethnicities that are kind of dominant. For example, I have a client out of New York that has a lot of Russian speaking clients. And so we built an AI bot, not just in English, but also in Russian, that can then intake those respective patients, right? So again, it's very versatile, but the idea here is to accurately bring them on board, have their information confirmed, etc. Right? The most accurate way that I've seen this done, especially when it comes to insurance verification, is to send the patient a link where they can upload all their insurance information, right? Where they can take a picture of their insurance card front and back. We use OCR tech to extract that information and then be able to go over to the next step, right? Which would be insurance verification. And to be frank with you all, I think Aerogram, the way that they're built out, it is godsend the way that it's done, because it allows us to not just verify the insurance if it's active or not, which a lot of providers already have that tech. The idea here is to really understand what that respective patient is going to owe for their visit type with that provider, et cetera, right? So, utilizing their smart verify tech, we're able to extract that information from the insurance card. We can, based on the visit type, verify the insurance at the CPT level. So we know exactly what's covered, what's not, and we know what the patient will owe before that visit, right? And so one of the biggest pain points that we see, for example, inside of the medical space, is that patients don't really understand or don't know how much they're going to owe because they have to verify the insurance on the medical practice end, right? And so that can be a few hours, a few days, a few weeks. And so all these kind of lead to massive pain points, right? Another issue that we also see is they may need prior authorization before they provide that service, right? So these are things that can be flagged using the smart verify tech from Aerogram to be able to then say, hey, this patient based on this visit type may need prior authorization. So then that way, you know who does and who doesn't. And then you're able to kind of very quickly identify them and get them verified so that that patient can be seen faster, leading to much higher patient satisfaction, right? One of the other reasons that we see a lot of no-shows in the medical practice space is that patients, if they don't know how much they owe, right, they're kind of hesitant to go because it can be a bill that can be $50, $75, $200 or more, depending on the visit type. So when they show up, it's almost like they don't know what's going to happen, right? So if they're clear as to what they're going to owe exactly, you can, one, let them know ahead of time, right? And if it's a high enough bill, you can set up a payment plan if you like, but you can also collect payment before the appointment. So then that way you can guarantee yourself that money before they show up. So then that way, you don't have to worry about no shows or nobody showing up or any surprises when you get there. So again, you can start estimating revenue with this kind of platform and this entire infrastructure. But, the goal here is to optimize the front desk and add specific workflows to make sure that once the patient is on the journey of booking an appointment or asking a question for your practice, there's different ways that we can get them on board. We can get them on board accurately. We can get them on board safely, and then very quickly be able to determine what they're going to owe, and then get that answer to them immediately, right? So the goal here is full transparency, and again, all done quickly, right? You can have theoretically a patient call after hours, let's say 7 p.m. on a Friday, book an appointment, have their insurance verified, and then they can be sent an email or an SMS, depending on the security, with their information of like, hey, for this visit type, or you're going to owe X amount of money, and then we can automate the sending of the payment link. And so by the time the practice arrives, they'll have the patient already booked, insurance verified, and the appointment's already paid. So this is the front desk AI infrastructure in a nutshell. The way that we saw it, one of the issues that we see overall in the medical practice space is that, based on statistics, 1 out of 2 physicians are complaining about burnout. They spend on average 15.5 hours on administrative tasks. 8 of those hours on a weekly basis are spent on EHR systems. So this can help optimize your front desk. It can definitely allow you to have what we call that exit velocity, where you can give AI a lot of different tasks to do for your practice. So then you can utilize that time however you see fit to make the best decisions for your practice to grow. So this is it in a nutshell. And now I'm open to any questions.
Yeah, fantastic. Thanks, Oscar. That was really good, really cool, very insightful. And yeah, I do have some questions, and then we also gonna take some audience questions. So in the audience, if you have any questions, please, you can put a comment on our event page so that we can receive and cover it towards the later part of the show. So okay, so Oscar, again, wonderful presentation. I also learned a lot of new things here, and I think it's a really amazing time that we live in right now, because all of this is feasible. I mean, we've been talking about AI, for a long time, but now it's kind of almost reached at the point of this like kind of magical, and I've seen a lot of skepticals, who said, okay, this is something you cannot automate. You need human in. And even they are, after seeing this working, they are also kind of converting and changing their opinion. So this is really becoming possible now. It's not just like theoretical, it's becoming
No.
practical, right? So when as a practitioner or as an administrator at a healthcare, working in healthcare, managing administrative operations or revenue operations or front desk task, how do I can see like, okay, I can actually automate the whole process. But let's say I want to get started, where can I get started? Is there anything specific use cases that are easier than the others to get started or make people comfortable, maybe within my clinic as well as the patients?
Yeah, that's a great question, Cash. One of the things that we suggest you get started with is the first line of defense, which is answering all your phone calls. Because the biggest complaint that we see in the medical space is nobody answers a call, right? Like they can call, they're on hold for 40, 50 minutes, sometimes a little bit less, sometimes a little bit more, but your patients are calling. And when you have a large call volume, you can either hire more people in-house, you can outsource that part of it, of that process. But then when you're outsourcing, it's very limited as to what they can say or do. But if you're able, at the very least, just handle the front desk, right? And so there's a few things you can do, and I'll show you. Not just answering, right? Suppose that the AI transfers to a specific employee or a specific department. What you can also do, if that department is busy, right, where let's say it rings to that department and they're on hold for, let's say, 30 to 40 seconds or a minute, You can then set up your phone line to ring to another AI agent that can answer the call, and then send the department or provider the message that the patient left, right? So and they can also do it in a way where if it's an emergency, they can immediately send an SMS to the doctor, so they'll know exactly what's going on, right? If someone wants to get a hold of that medical professional or that department, and they're having a hard time because they're just busy, we can set up an AI agent that once these calls bounce over to the AI agent, it can take the message, it can ask additional qualifying questions. Based on those qualifying questions, it can route to a specific department and say, hey, Cash, we just had a phone call from this department regarding this right here, and that could be sent however the client wants it to get sent. It can be sent to them via SMS, it could be sent to them via email in a safe and secure way, so that they can immediately understand what's going on and then take action and say, oh, I didn't know that this was happening. Let me go ahead and call the patient right away, so they can go ahead and solve that problem.
Okay. Yeah, and interestingly, this task you mentioned is also happens to be the first touch point that patient has. So if you get that right, maybe it's can have like a downstream impact. How you can actually start streamlining all the operations around it, right?
Yeah.
uh, at the same time, the information has to also flow very precisely and very clearly, so you don't because you have to rely on that information, right? And
Mhm.
one of the challenges that we have in healthcare, unfortunately, is that getting the whole system work together. So when you are like trying to automate all different tasks, okay, maybe using same tool or different tools, I assume it would be like at least would require a good number of tools to work together. So how do you make sure that those are all work together, and that also done in a manner that is HIPAA compliant and where the data is safe and secure, right?
So I look at it like a symphony, right? Because every tool is like an instrument that we have to make sure kind of plays well together. And so that we might be using AWS EC2 to store information or use it as a database. Sign a BAA with Amazon to make sure that that is compliant, and so all the information is encrypted. We can run our automations from that platform in a way, again, it's HIPAA compliant and safe. We can use other platforms, for example. One of my favorite tools to use is Go High Level. They have a HIPAA compliant piece as well that we can tap into. And so it's different, using different HIPAA compliant platforms, making them all work together in a way that's an infrastructure, so that the entire process, right, is very, very smooth. The first step that we take with
That's
any
been done, for some time. Like, is there anything different in with AI that makes the integration easier than earlier?
well, on the AI voice side, I'll tell you that it's just gotten better, right? And so, whereas let's say about a year and a half ago, it wasn't quite there yet, it was still kind of rudimentary. Now it's gotten to the point where level one, level two tasks it can handle, right?
Mhm.
And the ability to give it tools on the call, for example, to be able to an API call to the CRM, or to send information in real time. You're
Mhm.
giving it the ability to access database, knowledge bases, CRMs in real time, to then be able to answer questions in much more detail than you would otherwise, let's say a couple years back or a couple months back, right? So this is the era or the day of the AI agent, right? This is what we're talking about earlier in the year, that 2025 was going to be the year of the AI agent. And so
Mhm.
working, building out these systems, the idea is to give a tool so that it can complete an entire task without the need of having a human intervene halfway through.
Yeah. Yeah, that's very true. AI agents are becoming popular, so I
Mhm.
would agree with you. It's 2025 is year of AI agent. And I guess going back to the earlier question about how do we make all work together in a secure manner, I guess that's one of the services you provide, with
Mhm.
Great Digital, right? So that's interesting. And when you say AI agent, by agent we mean like we automate the whole process end to end, like kind of hands off, where you are relying on AI to not just do it one part of somewhere. It's like kind of doing its work as an agent. That's why you're calling it agent.
Mhm.
And so it kind of has a little bit of autonomy as well in that sense. So are there any parts of the workflow or processes where you need to have human in the loop, where I'm sure there would be different use cases where you can actually rely on agent, and some use cases where you need to have human in the loop, and
Yeah.
especially when you are starting out with this automation.
So that's a case by case basis, right? And so I'll give you a couple of examples. If we have a specific medical practice that deals with, for example, pediatrics, right? And so if they may require human in the loop if the patient is calling about a specific procedure, right? And so that they don't want AI to handle, right? And so in that case, when we ask the question and they answer that question and it triggers that workflow, then we should say, I'm going to transfer the call over to the human or to the department to then handle that respectively. But with AI, the goal is to build the system, right? The way I tell my clients is this: if you have a system already in place, right, that is repetitive, AI can do that for you. And I'll walk you through kind of an end-to-end solution. Not every single EMR platform has APIs, right? So there's workarounds that we have to have. We have to build an AI agent that is safely living in a server that can go ahead and receive the data, right? And then be able to input that data into the EMR system safely, right? So that's an entire workflow. They call the practice, right? They get transferred to the intake department, and so that intake department receives the information. It asks all the different questions, and then it adds the data into the EHR system, right? And so if the EHR system doesn't have an API, we have to do that entire process, again, using the AI agent to add it all in there, right? So that is all 100% done with AI. There isn't a human in the loop per se. If they want to, we can, right? And one of the things that we do is we're going to alert the staff of a new appointment, right? So that staff may be alerted like, hey, Cash has booked an appointment for 2 p.m. on Wednesday. So that can all be done with that. If for whatever reason there's an error, right, that happened during the appointment, the staff can be alerted as well, and they can kind of go back and see what went wrong. And so there's something that we can fix within the entire workflow. We can then fix it. But the idea here is to give it autonomy, right? And that's why we start whenever we get started, let's say with someone that wants to go step by step, we start first with answering all the phone calls, then intaking new patients, and then we can always kind of upgrade or add additional workflows. But the first step is that, and then adding the new intake, and then that way it can go all the way through. And that just these two steps alone allows their staff a lot more time to deal with higher ROI tasks.
Right. Cool. So I know there is some question from the audience. So maybe Shruti, you want to cover that question? Um,
We have a question from Mohammed who asks, can this be integrated to EMR systems like WebPT or Prompt?
I
Correct.
think
Yeah.
these are physical therapy EMR systems. Yep.
Yeah, absolutely. And the way I'll tell you is this: the way that it can be integrated, we build an AI agent via RPA, and so we're able to kind of fine tune that agent to following your process and how to do it, how to intake a patient. You let us know what that process looks like, and that's exactly what we build out to be able to then take the data from the phone call or from the SMS or from whatever source it comes from, and then adding that information accurately into your system. So
Right.
the end-to-end solution can be 100% done.
Yeah. Yeah, and actually, we work with some of the physical therapy practices, and some of the customers we have, they actually use WebPD and Prompt. So we integrate with their EHR as well. In fact, we are actually directly in touch with Prompt, and we can support others as well. And as you, Oscar, said, now with the AI tool, could be RPA or could be new edge agent that can actually work with a different system, even via interface. So that's actually interesting take as well. That has actually opens up, the whole new world of integration where you actually, go beyond what is even supported as well, right? So that's makes it interesting. um, yeah, I do have another question. Shruti, did you have any other question from the audience, or I can ask? Okay, so Oscar, we talked about okay, there is definitely ROI for the staff, admin staff. It can increase their productivity, their efficiency, right? But what about the patients? Are they comfortable? Are they ready? To actually deal with the AI system? Is it gonna build trust with the patient, or is it gonna reduce the trust with the patient? If you were to use the system. By the way, one observation is sometimes you actually don't even realize that this is done by AI. But sometimes you want to be upfront and transparent with the patient, and sometimes patients actually appreciate that
Yeah.
okay, you are using this system because as a patient, I want my provider to be more efficient and more responsive and act immediately without having to wait. So as a patient, I can also see those benefits. So what's been your experience? If you can share from your examples of after implementing the system, like did you get any patient feedback or
Yeah.
through providers or directly?
So, I would say after 100,000 plus calls,
Hmm.
the biggest thing I can tell you is this: you can't lie to your patients, right? And so, the way that we do it is this way: we immediately I advise the clients to let the AI know, to let the patient know that this is a virtual assistant and it's the fastest route to book an appointment. Because the biggest complaint that we see for medical practices is it takes a long time to do anything. And so if you can immediately let them know, hey, it's the fastest route to book an appointment, I can get you booked within a couple minutes, it's going to already build trust. We also have a few other tools at our disposal to build that trust. One of them is, for example, we can recognize the phone number and say, hey, Cash, I see that your phone number is 305-632-5362. Is that the best number to reach you at? You're going to say, yes, great, let's get started. So that right away separates it from most of the different automated systems that they're used to. What a patient really wants is to solve their problem. Right? Whatever that problem is, it's you want to be able to provide the AI tool for that. And so not everybody's happy about it. I would say around 3 to 5% don't want to do anything with AI. And if the moment they realize it's AI, they want to get transferred immediately. So that's normal, right? If that individual wants to get transferred, not a big deal. We can transfer you to someone at the department. But by and large, right, we don't see a lot of that, especially because the AI is very conversational. It knows what it's doing. Or you're giving it all the tools to answer questions. And so a client doesn't care if it's a human or an AI. They want a meeting booked. They want their question answered. And if AI can do it, great. If the human can do it, great. They just want their problem solved, right? And so that's all we're doing.
Yeah, that's great. So yeah, we are running out of time, but this was really great, helpful session. I see still some follow-up questions emerging from the audience, and yeah, to your question, Mohammed, yeah, we can have a personalized demo call with you, either with Crim Digital or with Aerogram. So Crim Digital can help you, Oscar can help you set up the front desk AI infrastructure, and one of the technologies they utilize is Arogram's AI agent. And so as at Arogram, we are kind of industry leader in terms of accuracy and how effectively, efficiently we do the benefit verification at the procedure level. So there are other um, webinar events also we have done. So you can also check out our earlier episodes, but we welcome all of you to set up personalized demo meeting with us, and we have other resources as well. Shruti, you want to share anything more?
Yeah, I'm actually sharing the link to some resources in the comments, and I'll be doing that post the event as well. So yeah.
Yeah, and we have a newsletter. You can subscribe to Efficient Care podcast, and of course, you can set up personalized personal meeting with Oscar or myself, and we look forward to seeing you. So yeah, that's it. So I think it was really enjoyed doing this session with you, Oscar. So thanks for coming in and sharing your knowledge, your advice.
Absolutely.
We
Yeah, thank you for joining us today, Oscar. Seeing the use cases of AI broken down the way you did was wonderful, and it highlights the transformative potential of such a technology in healthcare. And as I understood it, the ability to streamline front office operations is just the tip of the iceberg. So, to the audience, please follow Oscar's wonderful work. And at Aerogram, we love innovating, and we keep finding ways of keeping healthcare practices efficient. To see more such discussions, please follow us, Aerogram, and Cream Digital on LinkedIn. And please sign up for our newsletters and website.
cool. Thank you very
Thank you guys.